Hi, welcome to the Graduate School of Public Health. My name is Sally Wenzel. I'm chair of the Department of Environmental and Occupational Health. And just to give you a little bit of background on me, I am actually a pulmonologist or a lung doctor by training. I've spent my career trying to understand the immunology and the biology that underlie asthma and to improve its treatment, really kind of a medical perspective on asthma. But more recently, I think I have become increasingly convinced that there is a very strong environmental component to asthma as well that is really a public health issue. And I think one can think of asthma as a canary in the coal mine sort of disease, in that symptoms of asthma can arise very quickly around environmental threats of certain types, and really give you an early warning indicator of a problem with the environment. And so therefore, I think looking at the opportunities that existed in the Environmental and Occupational Health Department to really better understand the environmental issues related to asthma, the environmental justice issues beyond just pollution itself, but the impact on certain groups, which is certainly bigger than it is in others, the social justice issues, some of the health and racial inequities that occur in relationship to the environment. I was very excited to take the role as chair of the Department of Environmental Health a couple of years ago. And we're now moving forward in this space and really trying to understand the local as well as the national and international environmental threats that exist not only to asthma, but a variety of other health-related issues. And as part of that, we are establishing an Asthma and Environmental Health Institute here at the University of Pittsburgh, which will tackle some of these problems, and I think really serve as a resource to the community where, again, the challenges in the environment in Pittsburgh are perhaps even greater than they are in certain other parts of the country because of our pollution levels here in Pittsburgh still being higher than they are in most parts of the country. So I'm very excited to welcome all of you here for the fall semester. Clearly, public health is back in the public's eye. Something that I think many people really even sort of suggested we didn't even need public health anymore. Well, clearly, if coronavirus has done anything, it's been a wake-up call to the importance of public health for our communities. And I'm very excited to be part of I think, very forward-thinking Graduate School of Public Health, a very forward-thinking Department of Environmental and Occupational Health, who's willing to tackle these challenges of our time. The environment has expanded from what we typically thought of it as, and includes many, many layers as part of this. And not insignificantly, there are occupational threats that go along with the coronavirus as well, that again, in a Department of Environmental and Occupational Health, we are poised to take on as well. So it is with great excitement that I think even through these very uncertain times, if we stick together, we can in fact tackle all of these challenges and uncertainties, get through this, and hopefully through enhancing the importance and the aspects of public health that we can all play a role in, make a difference in the world. Thanks very much. I look forward to meeting all of you at some point, if not in person, hopefully sooner rather than later, at least through a Zoom. Thanks.